Hey, it's National Diabetes Month, and we've got a doctor that's going to brief you on the risks associated. It's becoming a Dr. York show. Friday evening, we had the folks from Charter Care and all those really top docs. Don't forget that Twin River event is next. No, it's actually the 14th. That's Sunday, I believe. I think that's Saturday the 14th. And it'd be a good chance for you to go to Twin River and talk to a doctor about a relationship, you know, or maybe you've got something that's worrying you and you just need a quick Q&A. So I hope you saw the Friday show, and if you didn't, you can go online at foxprovidence.com and check it out. Good Monday evening to you. Thanks for joining me on My State of Mind. I am Dan York. Yeah, so we have a top-notch doctor from Brown, Dr. Steve Kabasi, who will talk to us in kind of a creative way about diabetes. Most folks would expect an endocrinologist to talk to us about that, but he's a cardiologist, and he's going to kind of mix some concepts up and see if you can follow along as to what your risks are and all of that. So stick with us on that. In the meantime, let us go to the rundown and find out what's happening in the world. You know, this is a strange time when there's no evidence that points to it, but you've got ISIS that says, yeah, we did it. Headline is awful. It's tragic. You know, 200 plus people lost in the sands of Egypt when a Russian plane that had a lot of runs in it comes down, and the technical versus the sabotage, we're not quite sure yet, CBS reports.
U.S. intelligence sources tell CBS News the Russian jetliner that crashed in Egypt was likely not shot down. While some sources are not ruling out a possible bomb on board, the U.S. Director of National Intelligence says there's no proof that terrorists are to blame.
We don't have any direct evidence of any terrorist involvement yet.
Russian airline officials contradicted Egyptian reports that the pilot requested to land at the nearest airport because of technical issues. Metrojet bosses say there was no mechanical trouble or pilot error and insist some kind of catastrophic event caused the plane to dive into the Egyptian desert, killing all 224 people on board. Relatives broke down as the first bodies were brought back to St. Petersburg Monday.
It's unbelievable. So ISIS today puts out this statement, probably after that particular piece had been done for us on Deadline. The fighters of the Islamic State were able to down a Russian plane over the Sinai province that was carrying over 220 Russian crusaders. They were all killed, thanks be to God. You know, what do you say to that? So now the security folks have got to, and the aviation people are going to have to try to figure out whether or not they can prove that these guys and their claim are correct. I mean, the sickness of an organization that claims they did something when they perhaps didn't even do it is, well, that's new for us in this brave new world of terrorism now, isn't it? Say a prayer for those folks. I'm sure you have already. Next item, this is just, it's scary to see the mind of the Speaker of the House. Now look, he's been on a bad roll. I can't wait till he makes a good decision, because I'm going to have to jump all over it, because all I've done is whip up on this guy lately. But here's the headline. The Providence Journal has been doing this series on race. And so Nick Mattiello comes in for a conversation with a panel of folks assembled to talk about it. And he's asked whether or not he agrees with an op-ed column that previously had been printed in the Providence Journal about this concept called white privilege. And while we're not able to access the video, I guess, here's a transcript of some of the things that Nick Mattiello said. I'm not sure I ever thought of that phrase, white privilege. I don't think there is a white privilege. And worse yet, nobody has any privilege in our society. There are minority students that are thriving in Central Falls and Providence. They go on to great schools. It's not the majority, but it can happen. And more, drool, the opportunity is there for those people that really engage and take advantage of the opportunity. You know, Nick, just because you are trying to portray yourself as someone who's never had a discriminating thought doesn't mean that it doesn't exist. We need to go back and recalculate the data that shows that there's certainly a difference between white and black and white and Latino in this country. This is a guy who, I'm not concerned necessarily about having a debate on race. I want you to be thinking about the Speaker of the House, whose intellectual approach to conversations like this is like, I haven't seen it, so it must not be true. As opposed to something like, white privilege, interesting concept. Well, whether I buy into the concept or not, there's a lot of data out there and a lot of reality that we all know intrinsically and instinctively that tells us that the playing field's not level yet. So, it's a conversation that we need to keep having. Oh, no, I don't. And hey, by the way, there's a couple of kids in Providence and Central Falls that have actually gone to big schools, so I'm sure there ain't no white privilege. Police officers are doing their best to keep a stiff upper lip. I'm having one of those days. But when you see headlines like this, the Associated Press just put this out today. Hundreds of police officers in the country going down for sexual misconduct, like pull you over and ask you for service, if you know what I mean. It's a seething piece full of research and data and kind of an internal conversation amongst police officers in this country about the problem of some who make it so difficult for most. I think we've got to take this in context, but it is not helpful, and there's no doubt in my mind that we need a public relations program for police nationally and locally, because that's a tough job, and we owe them a lot. And these days, they're just getting their heads handed to them, at least PR-wise. Running in Cranston, yes, Mike Seepy made it official. He was here the other day. Here's the headline. Seepy announced his bid for mayor's seat. This is a longtime Democratic guy, ran the party for a long time. And as soon as the you-know-what hit the fan with Alan Fung, the mayor of Cranston there, and his problems with the state police report, Mike Seepy stepped in. In fact, he was here a couple of months ago to say, time for a change.
I think the city needs a change right now. They need someone who's going to be truthful. And in my 10 years on the council, Dan, I've always been truthful. I took a lot of heat, but I've always been the voice of the people. And that's all I've ever cared about was my constituents. Whether I was right, and a lot of times I was wrong, but I always came out and I said what I really felt.
I know he was the head of the city council for a time as well. Long history with the Seepy family in Cranston. Kind of unusual to start this early, formally, but it's tough to run against an incumbent, even Alan Fung, who's probably on the downside of public opinion right now. But he's got a lot of time to rehabilitate himself, so we'll see. Be an interesting race. And then, last thought, it's Monday after a tough sports weekend for New York fans, that's for sure, as I am one of them. The Giants got beat 52-49. You think you score 49 points, you ought to win a ball game. And the last-minute field goal for New Orleans comes, or the last second with no time on the clock, comes after a face mask called on the punter. When that happens, it's just not your week. And then, of course, at the end, it wasn't the Mets' year, at least for a world championship. Bad beat for the Mets. Yeah, they got beat 7-2, but it all came down to the top of the ninth inning. We've got some video from the network here if you didn't see it. It was a long night last night, extra innings. But, Matt Harvey said, I want to go in the top of the ninth after he pitched shutout ball. I think he only gave 4 hits. And, his manager just bought in. And Terry said, all right, go out and do it. And he couldn't do it. And then you knew the dam was going to burst. Kansas City, no doubt, a much better ball club. But, he should have pulled him after the walk. That's my thought. Your state of mind is important to us. 228-1886 is the number, of course. Email me at stateofmind@myritv.com. Barbara from North Attleboro sends us an email and says, hey, great show Friday night. I was glad to hear you and the other guy talk about Googling illnesses and what a bad idea it is. You can't imagine the amount of people who do that. It's crazy. And the other 2 doctors, re-engineering immune cells? Holy cow. Yes, well, perhaps more holy cow coming. Information on how you can steer clear of diabetes. 1 out of 3 adults are at risk. More data coming. So yeah, this is a couple of night in a row string. Just the schedule falls that way sometimes in terms of a health conversation here. It's, I don't want to talk about my health. Well, just wait, just wise up and take a look at this. This is National Diabetes Month by presidential proclamation. And you know, the truth of the matter is that unfortunately too many people are either with the disease or have a potential to have it. And Dr. Abbasi is here from Brown. By the way, the Brown Medical School is all over the community. We should make that point, right?
That's right. Yeah, the Brown Medical School, where a lot of the teaching happens, is sort of down in the Pearl District, but the students themselves rotate out through the Providence VA, over at the Miriam Hospital, over at Rhode Island Hospital. So they're really spread kind of all around.
How long have you been at the school?
Just a year and a half, roughly.
You enjoying it?
I think it's great. It's a very supportive environment for research, and it's been a fantastic opportunity.
So, what kind of research are you doing in general here? You're a cardiologist by trade, correct?
I am a cardiologist, so bringing a cardiologist in National Diabetes Month is an interesting choice, and I'm very pleased for the opportunity to speak about the cardiovascular aspects of diabetes. But the research that my colleagues and I do really relates to the way that diabetes and sort of the pre-diabetes can affect the heart in sort of in what we call subclinical ways, in ways that aren't detectable through your sort of routine screening tests, and also some of the things that happen that kind of evade and early detection. So the things that are the early damage that can lead to downstream consequences.
We should put up some charts here. Coach got me on that side. Let's put up some charts, and because this is stuff that you've supplied to us, and although you've got to stretch your eyes a little bit to read on the big screens at home, people can read this thing. $245 billion, the total medical costs and lost work and wages for people with diagnosed diabetes. Risk of death for adults with diabetes is 50% higher than those without, and the medical costs for people with diabetes are twice as high for people without diabetes. And those are drastic numbers, aren't they?
Just staggering. It is really, one of the major health issues of our time. And what's scary is that these numbers sort of reflect a snapshot right now, but the rates of diabetes, right now it's roughly 1 in 10 Americans with diabetes. The rates are unfortunately expected to rise to even more catastrophic levels. Sort of 1 in 3 is what's expected by 2050 if the current trends continue. And the main driver, unfortunately, for this has been lifestyle and the sort of obesity epidemic that I'm sure you and your viewers have heard so much about. But with sort of more sedentary lifestyles and dietary habits that are not so great, there's a rise in obesity and unfortunately a rise in diabetes.
Well, there's all sorts of stuff crashing down on the everyday American based on the latest reports. I mean, last week we found out that bacon's going to kill us.
Yeah.
So that there's a whole bunch of breakfasts that went awry last week, and but it makes sense that packaged red meat is probably not such a great thing. Forget the diabetes, just for the cardiology part alone, right?
That's right. Yeah. The data from last week that you're referring to kind of speaks to the cancer risk of some of these processed meats. But actually, one of the things that the American Diabetes Association.
You're right. I'm confused. It was a cancer conversation. Correct.
But
yes.
One of the things that the ADA is trying to put forward with this National Diabetes Awareness Month this month is really kind of talk about how you can actually eat very healthy and delicious foods. They have sort of 5 weeks where it's going to be breakfast, snacks, lunch, dinner, and then sort of desserts. And they each week they're going to focus on one of those and really give diabetics some options about how to go shopping for these foods and how to prepare them in a way that doesn't have to be bland, lifeless kind of food. It could really be a pretty good meal.
We should regroup here. Define diabetes.
Yeah, so diabetes is essentially the body's inability to handle glucose and
sugar. Right?
Sugar, yeah, sugar. And so we need sugar. We need sugar and we need glucose on a very fundamental level. We need it to run our brain. We need it to make our body energy mechanisms work. But diabetics and about 90% of diabetics are sort of type 2 diabetics, and 10% of them are type 1 diabetics. And the difference between the two is that type 1 diabetics have sort of a more of an autoimmune phenomenon where the body's sort of immune system actually attacks the pancreas and doesn't allow insulin to be made in sort of the appropriate ways. What we see mostly is type 2 diabetes, what used to be called adult onset diabetes. Unfortunately, and this is some of the research that we've put out, is that it's not always adult onset anymore. Again, going back to this idea of younger kids, younger and younger people getting obese. Some of the research that I've done has related to how young some of these kids can be that have sort of type 2 diabetes. And I'm talking about 15 to 18-year-old adolescents, and their hearts look terrible, Dan. They are not healthy-looking hearts.
How? Why?
So, one of the things...
Sitting around the computer too much, maybe.
It's definitely a big part of it. And we see that physical fitness is such an important aspect of healthy living. And, a lot is made about obesity, and I've spoken about obesity as well. But it's not just a matter of the weight on the scale. It's also a matter of what you do with your body, how fit you are, how much you actually go out and exercise. And unfortunately, we see that the physical fitness of our youth is really sort of plummeting, and that is probably the single best predictor of how many cardiovascular events these people have later on in life.
So when you research that, do you research why that's happening in terms of kids?
In terms of some of the social effects of it, yeah, that I think is probably a little bit out of my wheelhouse.
No, but you are the results guy of the social phenomenon of laziness or lack of proclivity to get out there and run around, man, right?
And part of it is that we haven't done very much research. The American Diabetes Association had our national meeting this past summer in Boston, and one of the main directives from the president was we need to do more research on sort of the psychosocial, behavioral aspects of why these kind of things happen. And if you look at, and not to say that we shouldn't continue doing research about new drugs and new therapies and earlier detection strategies, but we really need to understand, just on a social and fundamental behavioral level, what it is that's causing young people and old people, everybody, to sort of take on these unhealthy lifestyles.
All right, when we come back, we'll talk more about what you can do to kind of redirect the ship a little bit, because you can, right?
Absolutely.
All right, stay with us. So Dr. Abbasi continues with us here, and if you missed any of the first segment, of course, you can get it on foxprovidence.com after the first showing at 7:30 on MyRI TV. This is a show that you may want to take a few notes on. All right, so type 1 diabetes, is it okay to say you're born with it, more or less, or you acquire it kind of early, and those are the people that have to take their insulin shots and all that kind of thing, correct?
Yeah, partly correct. Again, one of the reasons why we need to do more research on this, we don't actually know. People are born with a genetic susceptibility for type 1 diabetes, but then there's some sort of second hit that comes along, and some people think it's a viral infectious process, and we just don't know, frankly. But you're right that these people tend to they require insulin at an earlier age.
But you know about the type 2. The type 2 is more clear. It's a lifestyle / I'm sure there's a genetic proclivity to acquiring diabetes, but at the same time, there are things that you can do to ward it off, correct?
That's exactly right. It is truly, although there are some genetic issues related to it, it is fundamentally a disease of lifestyle, and obesity is very, very closely linked to type 2 diabetes. Things that we can do to improve our blood sugar, as obviously the fitness is an important part of it. But one of the other things that we see is how you eat, when you eat, and just what you do after you eat. In fact, if you have a meal and you go for a walk, say 30 minutes afterwards, your blood sugar level is going to be substantially lower than if it was if you hadn't gone on that walk. And it's not about the calories you burn, it's really just about putting your body in the right metabolic state after you eat.
So it's a good thing to walk after you eat?
Absolutely. Yeah, about 30 minutes afterwards, go for a short walk. It doesn't have to be strenuous, and your blood sugars will be substantially improved.
Blood sugars move naturally even without diabetes, correct?
That's correct.
Based on, and people will notice that when they're eating or not eating.
Yeah, generally we're able to sort of maintain blood sugars in a range that's healthy, and it doesn't really affect our sort of day-to-day. We don't normally know it if you have a pretty good system of maintenance. So your body responds to blood sugar by secreting insulin from the pancreas. In type 2 diabetes, what happens is that over time, your body becomes less and less sensitive to the actual insulin, and eventually your poor pancreas kind of teeters out and isn't able to really kind of keep up with the demands, and you end up having to supply insulin yourself externally.
Okay, so based on what you're telling me, going out and getting some exercise after you have a nice meal, good thing. Eating late and going to bed, not so good.
Not so great. Yeah, there's been a lot of debate about just sort of how your body stores carbohydrates at late hours. Generally, the idea is to actually avoid sort of those late meals, and I think your body will be revved up in the metabolic state that's more favorable if you avoid that sort of habit.
There's other charts here that you brought. I want to make sure I don't miss any of the data stuff before I ask a couple more questions. 86 million people, 1 out of 3 adults could be pre-diabetic. 9 out of 10 have no idea. But so 1 out of most doctors on an annual visit will be able to tell the patient, hey, you're in a situation here, correct?
I wish that were the case. Unfortunately, there's so many. When we say that up to 25% of people don't know they have diabetes, I can't tell you how often I'll be working in the cardiac ICU at Rhode Island Hospital, and somebody will come in with a heart attack, and their blood sugar will be through the roof, and we will ask them, did you know that you had diabetes? And they'll say, no, I've never found this out before. And so there are a lot of people who don't.
Is it because they're not going to the doctor?
That's part of it, and part of it's also the screening is maybe not quite as robust as it needs to be. As primary care doctors, we all need to be probably a little bit more aggressive about how often we screen. I think part of it is that we've become so used to people being overweight that it doesn't really have the same kind of bang that it used to. People having a body mass index more than 25 used to be a really impressive and sort of unusual thing, and it would sort of put off a bunch of alarm bells. That doesn't happen anymore because it's now 65% of Americans are overweight, and almost 2/3 are obese. So it doesn't kind of give us the same impact that it used to.
All right. So what can chubby talk show hosts and others do to ward this potential off?
So what you can do is do moderate amounts of exercise. That is the real key. It's finding that balance between all the other pressures in your life and the demands, and really getting about 30 to 45 minutes of moderate amount of exercise. It doesn't have to be training for a marathon. It doesn't have to be climbing a mountain. It really just has to be just sort of a moderate amount of fitness, and that is the best thing you can do. And it really is a matter of getting your body revved up metabolically to where it's processing things in a very different way. It's not just about calories. There used to be this idea that it was simply a matter of calories in and calories out. It's not that simple. It's really about how your body's charged up and how it works throughout the day.
So get a good sweat when you can.
Get a good sweat, exactly.
Yeah, and the walk for a half an hour, is that equal to the good sweat?
The walk for half an hour probably is better for helping your body handle some of this kind of bolus of food that it gets. But the good sweat is, and it can be done really anywhere in any place. There's some, sitting down throughout the day is not a very good thing, unfortunately. Just by standing up, you burn about 1.5 times of the amount of calories, and these sorts of little simple things are ways that people can improve their sort of health throughout the day.
All right, I appreciate the advice. Are you bullish on the idea that people can fix this problem?
I have tremendous hope that people can fix this problem. I think that one of the things probably in the last 10 years that we've seen has been a real improvement in the way that people think about their food, and there's been a real concern about this, and I'm hopeful.
And get a sweat. Doc, thanks very much. We'll be right back.